Any more questions?
So on the clinical testing, so what are you all, okay, thank you. So have you found anything out that would work good for pancreatic cancer? My husband had it, and he lived for 2 years, and he went back and forth to several doctors doing so many tests. And so when they really found out what it was in its last stages.
A lot of the cancers, particularly pancreatic cancer, is very aggressive and it just grows rampant once it's found. Oftentimes, and I'm going to say it from a clinical perspective, in any level of cancer, what we can do as a race of people is to take care of our bodies in a prevention status, not just show up when there's an ache and pain, get our physicals, get our testing, and get blood work that is less expensive to get in a stage of prevention versus cure. So I recommend, I have no answer for the pancreatic question on cancer. I don't know any clinical trial or study offhand, but I do know as a clinician, one of the things that if you are on a workplace that offers preventive services, take advantage of it. Don't let it just roll over to the next year, because you may not be at that job the next year because the company may not be there. So from a preventive state, make sure as a person, as an individual, take care of your bodies. Go get that preventative health care exam because it's cheaper. And it's usually covered by your insurance companies versus a cure. Okay? That's just my answer.
I would just like to echo that briefly. Pancreatic cancer is difficult to diagnose. Usually by the time we've picked it up, it's often too late. I would have to say there are a number of clearinghouses that you can go to look for clinical trials. There's clinicaltrials.gov. I think that's the most well-known one. But as far as speaking to specific clinical trials, I think we're somewhat limited just in that's not our area of expertise, and I apologize for that. She may have. Do you have a response to that?
Yeah, I do.
Can you give the lady in the front?
I got it. So I work at UT Southwestern Medical Center and the Simmons Cancer Center, and we do have clinical trials ongoing in pancreatic cancer. What Dr. Skrine said is right. Pancreatic cancer is really hard to detect. My father passed away of pancreatic cancer, and so his situation was very similar, that by the time they figured out what he had, it had already spread to his liver, and then that was pretty much it. And that was in 2000. We're not physicians, but my team here works in the clinical trials office at the Cancer Center, and there is a lot of new research going on specifically in pancreatic cancer, and I believe they're even starting to look at the genetics. I don't know a lot about it, but I can try to find out some information and see, what I can compile that I could send back to the organizers of this program, maybe to send out about that later. So, thank you. You're welcome.
We have any more questions? We have a question right here.